Hi, I'm Dr. James Meschino. What are the side effects of ibuprofen, aspirin, indomethacin, volataren, which is also known as diclofenac, even acetaminophen and other anti-inflammatory drugs? Well, the non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, and so on, the way that they work is they block the buildup of an inflammatory hormone in the body called prostaglandin series 2. So the body, when there's an inflammatory response, is taking a fat called arachidonic acid and converting it into prostaglandin series 2, and that creates a lot of inflammation. So those drugs are basically blocking the enzyme that allows that to occur. That enzyme is known as cyclooxygenase. And so, they have a very good anti-inflammatory effect. The problem is that they're so powerful, they have some unintended side effects, as you know, and if they're taken over a long enough period of time at a high enough dosage, then side effects start to occur. Originally, we thought the risk was just primarily it would cause irritation to the stomach. A lot of people get stomach aches when they take those drugs, and then it can lead to erosion and then ulceration and then bleeding in the intestinal tract. But more recently, we've seen some other health concerns. So in a recent review paper called Cause for Concern in the Use of Non-Steroidal Anti-Inflammatory Medications in the Community Population-Based Study by Dr. Robert J. Adams and followers, it posted on September 27, 2011 in the Biomedical Central Journal called Family Practice. So it's fairly recent. And so the review is showing that these drugs are causing a lot of gastrointestinal irritation and ulceration. In fact, 10 to 20,000 people die each year in the United States from internal bleeding due to the use of these anti-inflammatory drugs. That's not widely known. But we're seeing now that it's also producing chronic heart failure, which is another common cause of death, or causing cardiovascular deaths in people that don't have other major risk factors for cardiovascular disease. It's also raising blood pressure, which we didn't realize before was even happening. And we knew it was causing liver damage, but now these drugs are becoming a leading cause of liver failure, and they're also causing kidney damage. Acetaminophen in particular causes a great deal of liver damage, and there's a lot of kidney damage that can occur, leading to the need for dialysis later in life, or requiring a kidney transplant. So, you want to avoid these things happening to you. So I'm not against these drugs. I'm just saying that you want to try to use the least amount of them possible. And this is where diet and supplementation comes into the story, because diet and supplementation can reduce inflammation and reduce pain, and certainly doesn't have the toxicity. I'll give you some examples. The combination of curcumin, boswellia, ginger, white willow bark extract, a great combination of anti-inflammatories that are all natural that can reduce inflammation without any significant side effects. The same is true for the flavonoid quercetin, for bromelain enzymes, taking higher doses of vitamin D, and there's other ones as well. But of course, you have to use the right dosage. You also need an anti-inflammatory diet. It sounds a bit complicated, but here's the truth is that a lot of rheumatologists and orthopedic surgeons and family doctors fail to explain to the patient what are the dietary practices, what are the supplements, what are the best exercise for somebody to reduce inflammatory diseases. And it's very unfortunate, because these things can make a big difference and reduce your reliance on some of these prescription drugs that are anti-inflammatories that have these kinds of side effects. So that's why I'm encouraging you to do something that I think everybody should do if they have any inflammatory disease. I have an ebook that I created. It's called Proven Natural Remedies for Joint Pain, Arthritis, and Inflammation. If you're using anti-inflammatory drugs or you need them for any reason, you should download this. You can get it right here. It's available right here. The booklet outlines the exact lifestyle plan that'll help you manage any arthritic condition and can be used along with any medical treatments that you're presently undergoing. So you can take it in conjunction with some of these prescription or over-the-counter drugs as well. In fact, every arthritic patient should have a copy of this ebook, The Proven Natural Remedies for Joint Pain, Arthritis, and Inflammation. So download it right now if you have any inflammatory disease at all. Now, at MeschinoHealth.com, you will see my other review papers, my teaching materials. You'll see footage from my live seminars. You'll see downloads that I've created, other resources that are all available to you for free that will help you lead a long, healthy, highly functional life. It's not enough just to be alive with a heartbeat. You want to be highly functional as the years go by. All my research papers and my teaching materials come complete with all the scientific references, so you know you're getting only evidence-based information on any health topic that you might be seeking out. So make sure that you use meschinohealth.com. It's an ongoing, reliable resource for both you and your family members when you're looking for any health or wellness information. Come back and visit us whenever it makes sense for you. Thanks so much for listening.